Yep, we're live, Chair.
Right. All right. Right, members, welcome to this meeting of the Children and Young People Scrutiny Panel, 27th of October. Agenda items. Number 1, substitutes nominated for this meeting, and apologies for absence.
Hi, Chair. We've received apologies from Councillors Ford and Foster, and Councillors Baines and Smith are substituting on their behalf. And we've also received apologies from Sheila Hurst and Pranitha Barath.
All right, good. Welcome to all the substitutes. Members' interest. I will remind members they need to declare any pecuniary, disposable pecuniary interest or other interests that may have items, they have in items on the agenda. We'll do it now or at the appropriate time. You're going to have to speak or put your hand up like Danielle has just done. Danielle?
Sorry, Chair, my usual. I don't think there's anything specific, but I obviously will declare as well. I'm a school governor, so
Okay,
thank you.
Admission of the public, we are live on YouTube. Minutes of the meeting, 29th of September. Again, if members, 2 members could please speak that they can propose, because I can't see everybody. Anybody?
Yes, I will. Sorry,
Councillor Holdsworth and Councillor Derrans. Thank you. Propose and second that. Right. Item 5, members. Before we start, just remind you, if you want to say something, ask a question, please use the chat facility, because it's no good waving at because I can't see you. Usually my connection gets better as the evening goes on, but we'll see how it goes tonight. It's a bit stormy out, so who knows what's going to happen. Item 5. Complaints and Representations Annual Report. Julie. Yeah.
Thank you very much, Councillor Rostrick. We've got 2 members from the complaints team that have joined us this evening as well. I'll just ask them to introduce themselves. And I think everybody knows who I am. I'm Julie Jenkins, Director of Children and Young People Services. Can I ask our colleagues from the complaints team to introduce themselves, please? There's Lynn. Shall I start with you, Lynn?
Hi, I'm Lynn Hagan. I look after complaints and compliments and also homelessness prevention for Calderdale.
Thanks, Lynn. Richard?
I'm Richard Noble, Complaints Officer.
Lovely, thanks, Richard. Richard, are you taking us through the headlines of the report? Members will have read it, but is there anything that you or Lynn wanted to highlight this evening?
Well, all I'd noted was that I thought it was a positive report. I think we're showing a bit of consistency in how we deal with complaints. And basically, I just wanted to highlight that, you know, it's positive and open up to any questions.
Thanks, Richard. Over to Scrutiny, Councillor Rostrick. Thank you.
All right, Julie, thank you. Members aren't asking anything, but I'll ask something first. Again, I agree with Richard. It's a very positive report. We seem to be pretty consistent. I noticed that there were 4 reports, 3 of which came through the Child Advocacy Service. Do we feel we have an adequate Child Advocacy Service? Have we got enough advocates? Are people aware of their advocacy rights? And 4 out of the 29, was it, came through advocacy?
Yeah, we do have an advocacy team that's run independently to the mainstream social work part. So it's under Jill Holbert, who many of you will know, the Assistant Director for Commissioning. She has the quality assurance arm that oversees the work of children's services, so the independent reviewing officers, and she's also got the advocacy service in there. It's managed by Cheryl Baxter. During the youth services review, after your scrutiny review, we did move some additional resources both into the young carers team and into the advocacy team. So we put another additional 2 workers into the advocacy team to make sure we could increase the capacity. I think some of you may have seen reports either at Scrutiny or Corporate Parenting about that team, and saying that the more capacity we had in there, the more young people could have advocates if they were looked after or if they were going through the child protection system itself. So there is more resources in there. It's meeting the need probably better than it ever has done. You do get a regular report on advocacy to corporate parenting as well.
Right, do we, I've got my point and I'm just actually doing. Are we happy with the proportion of complaints that come through the advocacy service? Should there be more, should there be less?
I think it's a difficult thing to say. I think it's interesting when you look at the numbers of complaints overall coming in, that they've kind of stabilised of the complaints and compliments around at the same level. I think if you go back, because Richard's got some graphs in there going back many years, you can see that there were periods where there were more complaints and more issues coming through for young people, and it's one of these things sometimes that you can't really say why, that we do get a year where there are more and more complaints. Sometimes there are less. They do seem to have steadied down over the last few years to be a consistent level. I think it's important that children's voices listened to. As you know, that's why we usually have Pranitha here, so you can hear directly from young people yourselves. And the independent reviewing officers have a really important role to listen to young people independently before their review, to hear what they have to say, what they want and how they want their voice to be heard. And it'll be helpful, I think, for you as well to hear from Pete Roos later on when we look at the SEND review, particularly about the voice of parents and children with special educational needs and disabilities in Calderdale too, and how that's listened to. So it's a difficult one to answer, Councillor Raystrick. Is there a right number for child protection referrals coming through? Is there a right number for advocacy cases? I think it depends on the need. If the need is there, I think the independent reviewing officers and the advocacy service will pick up those issues and make sure that they're brought to the attention of the service to address them.
All right. We're obviously not staying as a status quo, so how are we improving this service? I noticed you're meeting with the Foster Care Association, staying put policy, where we'll have child, etc., etc. These are the lessons learned. What do we see as the emerging lessons to learn?
Richard, do you want to touch on anything, or do you want me to come in?
All right. Can you just say that again? It's a really bad connection here.
Yeah, I can hear your connection's not that great. Councillor Raystrick was asking about the learning, some of the learning elements from the complaints and some of the recommendations that have been made and picked up. For example, the fostering, meeting with the Fostering Association. Is there anything you want to comment on there, Richard? I think Richard's...
Well, all I would say is... Sorry, can you hear me?
Yes, go on.
Yes, so like in addressing the learnings, we chiselled down a lot in them. We kind of have regular meetings with myself. It used to be Bernadette and now Cheryl. So every time complaints come in, we sort of go through them from start to finish and see what needs to be picked up on for the learnings. And they're all sort of fed back through the service. So everything that does come in through a complaint is treated and highlighted for acting on within the service areas.
There is an action plan, isn't there, Richard, from every complaint in quite a lot of detail that goes to the complainant. And then those actions are tracked by Bernadette and by Rob's service to make sure that they're being finished and completed and signed off. Do you want to say anything on that, Richard?
Yeah, so basically, we do this on when every complaint that comes in, we do it on a monthly basis. So we trim down what needs to be learned. We do an action plan. I do a feedback from all the complaints, and they all get signed off. Hopefully that it improves service moving forward and seen as a positive outcome.
Right. I think you're going to get a quick exposure to scrutiny tonight, Richard. I like the report. The compliments, let's not forget them. 44 of them is a good outcome in a year, I think. You're joining a long stream of reports where I think scrutiny is in general is pretty happy with the way things are going.
Good.
And I think that's credit to the good work that goes on. I've been in meetings when this report has been a lot more controversial than it is this evening. So that's all credit to you all. If members have no further comments, I'm going to let you go.
Sorry,
and,
can I just quickly say, sorry, I did try and put my hand up. I'm failing a bit
Sorry,
on IT. No, it's fine. I just wanted to say, just make a comment that it's really important that we take the complaints seriously, of course, but it is also really good to see some compliments in there, because I mean, we know that for every compliment that's actually forwarded to us, hopefully other people will be feeling, you know, there'll be quite a lot of other people who haven't maybe quite got around to putting pen to paper or finger to keyboard, but you know, that actually, so you know, that it's great, and it's great, and that obviously some of these are from young people as well, and that's really heartening as well. So thank you.
There's quite a lot of rich detail in the level of compliments there, and you'll see the mention of the front door health check there. That was for Zel Radovic, who you've seen a couple of scrutinies ago, the service manager at the front door. He went to do a front door health check at Barnsley, so this is their comments back to him. And Rachel Brady, I think, went with him as well. So yeah, lovely feedback and lovely comments from the young people and the families.
It's important to be loved. Right, members, that's item 5 done, I think. Thank you for your attendance.
Thank you.
Richard and
Thank you. Cheers.
And Lynn.
Oh, thank you. And Lynn. And Lynn. Thank you very much, Lynn. You got away light, Lynn. Telling all the officers scrutiny is a piece of cake.
You might regret that next time.
Take the wins when you can, Lynn.
Yeah, I know. Thank you. Bye now.
Thank you. Members. Again, my screen. Ooh. Item 6. One of the major of the evening.
It is, yeah. Thanks, Councillor Roestrick. Joining me this evening to present this report to you is Ben Olchin. I'll let Ben introduce himself to you in a second, who's our service manager for children with special educational needs, and Pete Rose, who some of you met at the beginning of the meeting. I'll let Pete introduce himself to you from Family Voice Calderdale. Shall I just hand over to you first, Ben?
Yeah, hi everybody. I'm using a new microphone. Can everybody hear me okay?
Yes.
Yeah, fab. Okay. Yeah, it's really good to see everybody. It's nice to see some familiar faces as well. My name is Ben Olchin. I'm the service manager for SEN and inclusion. So that means that I run all of the services, or I organise all of the services, the educational services and responsibilities for children and young people aged from birth to 25 who have special educational needs and disabilities. So I've got a few teams within my portfolio, including the statutory assessment side of things, that looks at children's needs and the provision that they require. I also have a team of staff who provide specialist teaching and support in schools and at home. I have the medical needs service, which provides teaching for children who are too poorly to attend school. And I also have responsibility for the commission and contract of educational psychology services for the council, the statutory element of that. So I've got quite a few bits and bobs going on. And I'm hoping that you've seen from the report, we're doing a bit of a wide ranging really and whole scale review of all of the services that we offer for children and young people with special educational needs and disabilities. I started in this role in January this year. It feels like a lot longer than that, but it's only 10 months ago. And together with Leslie Boyer, the assistant director, we both realised that actually a lot of the landscape had changed, partly to do with COVID, but also to do with lots of other kind of factors that were outside of our control. So we decided that now would be the good opportunity to really look at what we're doing for children and young people with SEND, to make sure that we're really focusing on what families are asking for, and really putting the right support in at the right time. So that's why we're doing the SEND review. As you can see, it's got 9 work streams. It's not 10, there's 9. and we're about halfway through those work streams at the moment. There's a lot of positives in there. I've tried to make sure that the report reflects some of the positives. There's a lot of engagement with our schools and settings who had felt a little bit like they'd not had that engagement from our services before or for a while. There's a lot of individual feedback from families and children and young people, and we're working towards making that more of a strategic component moving forward as well. Yeah, in terms of the next steps, I think I've put that in there as well. You know, we've got a big event with our families coming up in November. We're increasing our coordination with health services and transport and other wider services as well, just to make sure it's as holistic and robust and rounded as possible. And yeah, so I'm happy to go straight into questions if that's okay.
Yeah, I think I'm happy to do that as well, Ben.
Fantastic.
Can I just bring Pete in at this point, please?
Of course,
Go straight first. Is that okay?
Yeah, fine.
Just for Pete to introduce himself as well, explain your role, Pete, and how you're involved with SEN and the council as well. Thank you.
Right. Now I've got a voice. Okay, I'm Pete Roos. I'm chair of Family Voice Calderdale. Family Voice Calderdale is the parent carer forum for Calderdale. It's a bit of an arcane world, parent carer forums, and it's important that you know what we are and what we're not. What we're not is we're not a campaign group, and we're not an advocacy group. What we are in Calderdale is a voluntary group of parent carers of children, young people with special educational needs and disabilities. We sit as a project, a discrete project of Unique Ways. So they're our umbrella organisation that look after us. We get an annual grant from the National Charity Contact a Family, and that in the first instance that comes from the Department for Education, and it's for participation and engagement of parent carers. Obviously we're quite interested in children having a voice too, and young people, but our remit is the voice of parent carers and how that and engage is a part of decision making, and so at a strategic level we have parent representatives on the work streams. I know that they're kind of in abeyance at the moment, but mostly. But we do have, for example, I sit on the SEND strategy board, and so does the chief exec of Unique Ways. So in that way, we're part of the conversation. We also have parent reps on some of the decision-making panels. That was a serious decision that we took to do that. And in the end, it boiled down to, is it better to have someone in the room with lived experience being part of decision-making, or is it better not? And, you know, obviously we went with it's better if there is someone inside the room. It's the nothing without us, you know, nothing about us without us thing. Okay, so we're a small voluntary group. We've been buffeted by COVID. Our capacity is quite, you know, it's at its limit, I'd say. But I think, you know, knowing that we've got a regional network and a national network of parent carer forums, I know that we punch above our weight in Calderdale, actually. You know, we do work very, very closely with services and with officers, and have pretty good channels of communication. And we've got a track record of having had some quite difficult conversations and tackled some quite difficult issues, and made a difference. And you know, for example, you know, the number of complaints about short breaks went down after we did a job on it together. And so what we want is to be working with, and that's our that's our default strategy, really, is co-production. Some people don't like the word co-production, so we also use working with. Don't want to alienate anybody. Okay.
Thank you, Peter. I'm not easily alienated, I have to say.
Okay.
Councillor Hutchinson, Colin.
Thank you, Chair. I'd like to declare an interest that I'm a trustee for Halifax Society for the Blind, and that for 35 years I worked as an eye surgeon, including with children with visual impairment. So I've got a particular interest in making sure that this review enhances the educational opportunities and the general developmental opportunities for children with visual impairment. I also fully understand that in many children, they have multiple needs, so that they overlap into different areas of concern. I mean, my interaction with qualified teachers for the visual impaired while I was working was that when children were being assessed as to the kind of visual problems they were experiencing and the likely progression or otherwise of them, that a qualified teacher for the visually impaired would come into the hospital outpatient clinic, be able to discuss with the parents present, with the various professionals there, as to what the kind of visual problems these children might be experiencing. It's also important that they get specialist input right from birth, because bringing, finding that you're bringing up a child that doesn't see as most children do, unless strategies are put in place at a very early stage, it can lead to social isolation, problems with interacting, which then impact on education further. So I would like to be, in terms of the specialist inclusion team, I would like to know how the capacity for that specialist input from, say, qualified teachers for the for people with visual impairment, do we know what the baseline capacity requirement is for that service? Because otherwise it's difficult to know what the staffing needs are. It's also important that there's a lot of equipment and whether that's software, hardware, or other things that can make it much easier for children with visual impairment to access education. And because not many teachers are going to have exposure to that many children with these problems, having good quality specialist advice in what's required and in getting children started with the equipment is important. And I would also like to ask about the level of consultation and the consultation materials that have been used to get the input of parents and young people who are going through education with visual impairment into the service that they've been receiving and what they would be hoping for in the future to help shape the service. So, I know, Ben, you've already answered, approached a number of these questions, but I think it would be helpful to understand them in the context of this review.
Ben.
Yeah, absolutely. Thank you, Councillor Hutchinson. So you're talking about Stream F, which is the Specialist Inclusion Team Review. So that's my team of specialist teachers, advisors and support staff. And their job is to work primarily with schools, but also with families, but primarily with schools and early year settings and colleges to make sure that schools have the right advice, the right equipment, the right teaching, to help children with additional needs make progress. Now, for some children, particularly those with sensory needs, such as visual impairment, hearing impairment, multisensory impairment, where they have a bit of vision and a bit of a hearing impairment, it's slightly more complex than just saying, okay, we'll go and advise a school how to teach a deaf child, for example, and then they get on with it. It doesn't work like that. So we have mandatory qualifications which we have to keep within any structure in order to facilitate the teaching of children and young people with those sensory issues. I think absolutely, you talked about early identification, and absolutely that's what we firmly believe in. We really want to get the support in as quickly as possible so that we can begin to assess and identify what those problems are and what recommendations need to be put into place from our own services, but as well as the schools that they're in. The stream around the specialist inclusion team structure is all about creating resilience and accountability within the schools to try and do as much as they can with as much resource and as much experience and knowledge as they can, but recognizing that we do still have a part to play on that. We hold the expertise in certain areas, and that's certainly recognized in the new model. So the questions that you asked, I think, were, do we know what the need is around visual impairment? So we use what's called the NATSIP criteria. I'm sure, Councillor Hutchison, you'll be aware of that with your background. But NATSIP is a national organisation which set eligibility criteria and benchmarking so that all local authorities can subscribe to very similar levels of eligibility. And so we use that currently. And there's no change to that. We'll continue to use the same assessment model. So the levels of need that we have now, we'll still have them. We're not changing the method or the ratio of how much support they would get, for example. And what we're trying to do is increase some flexibility around how we deliver support. So a good example using visual impairment, Councillor Hutchinson, is that we recently had one of our QTVIs, our qualified teacher of the visually impaired, reduced her hours. She went on part-time, semi-retirement, early retirement. And it was such a difficult situation because we couldn't recruit. We went out to advert, nobody applied with that relevant qualification. And so we were looking at potentially recruiting somebody without that skill base and then training them up. Now, because we're in such a small authority and our teams are very siloed at the moment. So we have a siloed team for visual impairment, siloed team for hearing impairment, autism, early years, etc. And it was really difficult to be able to move the resources and the planning from one team into another. Now, we had a member of staff within our early years team who was desperate to be a qualified teacher of the visually impaired, but actually we had to wait for it to go out to advert. She then had to apply for the advert rather than us being able to really think about it and forecast properly and do some real succession planning and be able to try and find reasonable solutions that are a lot quicker and a lot more streamlined than the current situation will allow. So I'm hoping that the new model will allow for that real sense of forecasting and forward planning that we can't currently do. The other thing is that obviously the support for children with a visual impairment is wider than just the qualified teachers of the visually impaired. So we have, for example, braillists, communication support officers, and they are going to be brought more holistically in within the team. So rather than having one person doing that and there being a risk about, for example, if they're ill or if they're away, we're bringing that to be a much more holistic offer, so that we've got more members of staff who are able to do those kind of things. So, for example, with the Braille groups, one of the things that we talked about was having, when we do our youth clubs, for example, about having somebody there to support the offer, to support a Braille offer for parents potentially. So obviously the parents can support their child's reading skills as well, which we don't currently have. So there's this new model adds a lot of flexibility, which I think will be better, which will better enable us to meet the needs of children with a range of needs, really. The other question was about consultation. So like I say, I started here in January, and actually I'm going to come to Pete in a minute because he can tell you about some of the journey at the very beginning of this process, which was around 2018, 2019, when we started to talk about reviewing our specialist inclusion team. And actually the first significant section of any of this is about co-production. So it's not just the council coming up with something and then putting it out to parents and saying, what do you think? It's about really engaging them to help us design what it was that we were looking for and really getting to grips with what it was that they were telling us about our services, what was working well, what could be improved. One of the things that came out of that co-production really strongly was that the quality of the support on offer from our specialist inclusion service was fantastic. Nobody was doubting the quality. It was the availability and the capacity of those services that was the issue. And so we took on board all of that co-production work and then came up with a model that we felt best reflected what people were asking for. We're now currently out in a formal consultation on that model, and we've had really high levels of engagement from parents and carers. And it's worth saying that there was a slight issue at the beginning of that formal consultation period, and we realised that not as many parents had received the information as we'd have hoped. And so we changed that around 3 or 4 weeks into the consultation. We extended the consultation slightly to take account of that. But we've had 5 Q&A sessions with parents last week, and yeah, we've had a really good response from our parents and carers. Pete, do you want to talk a little bit just about that initial stage, that co-production journey that we participated in?
Yeah, of course. It was 2 years ago, more or less, that we did a focus group, and that was co-produced. It was a very nice piece of work, actually. That we constituted a group of parents with varied experience of impairment to represent knowledge of the different elements of the specialist inclusion service, and age range as well. We excluded a few people, and I'll talk about them because they didn't fit the criteria. You can take it as read that parents really, really value the expertise of the specialist inclusion teachers. They know more than anybody that that specialist knowledge and those specialist skills are necessary for the right kind of support to be available for their children. What came out, and this is typical, it comes out a lot, very, very strongly and very clearly, though, is that on top of that, parents really value the specialist inclusion teachers, because when they do eventually get into school, they're validating what parents have been saying, sometimes for years, and often schools have not been listening. This is a common theme in the stories that parents tell about their experience. And on top of that, it's that they ensure that plans are put into effect. The shorthand that I use talking about it is that they police the plans, and parents are pretty clear that without that attention, without that expert attention on them, that quite often, significantly often, that plans wouldn't be operationalized. And we've got a bit more evidence of that, actually, that the people that are followed up, I did semi-qualitative interviews with them, sat down for an hour and followed our noses, but with using the focus group framework as a framework, and that came out that identified gaps. So there's no specialist teacher for learning difficulties, for example. And I talked to one mum whose lad was coming to the end of his school career. He had an EHC plan. She said it was a really good plan, spot on, perfect plan. It was just never put into effect. And however much she said it, there was no one there to make sure that it was put into effect. And it was heartrending, actually, that she spoke of, just the wasted opportunity of an educational experience and an educational career, that this lad could have got so much more out of school. And we think that probably another gap is around ADHD as well, and that kind of expertise and behaviour. There's a lot of demand for support for behaviour. What parents want, though, and this comes out really clearly, it came out in the focus group, but it comes out all the time, is they want their children to be included. And they do see that the specialist inclusion support enables that, but also is necessary for it. They want schools to listen to them, parents, and not have to have the heavyweight expertise go in and make sure that happens. That expertise is necessary, like Councillor Hutchinson said. You know, it's technical expertise that our children, they need that support. But schools can be more inclusive. And I heard a story last week, a girl with visual impairments, the secondary school, they instituted, because of COVID, they instituted a one-way system, and she got lost, kept getting lost, kept turning up to lessons, kept getting told off. And that's a little thing, but actually it's a big deal for a teenage girl to have, it's an exclusionary process, basically. And that's a bit concerning, that because actually that's easy, you know, that's really easy. If a child's got that kind of level of visual impairment, the school knows about it and all the teachers should know about it, and it should be, oh, okay, you know, look, you need a buddy or something. So at the beginning of that process, we had quite a detailed set of insights into the experience of parents and children and their children as they reported it, of the specialist inclusion service, and where some of the gaps might be, what some of the features might be. Then we had COVID and actually quite a lot of staffing flux in local authority. And I think that in an ideal world, there would have been a stronger thread of co-production through that, but there hasn't been. I can't say that I'm worried because, you know, there are just really good reasons for it. We have been part of the conversation at a strategic level through the SEND strategy board. And so we've kept in touch. Last year, we collaborated with a quick survey around the specialist inclusion service, and that echoed what the focus group had found.
All right, thank you.
And just to say something about the consultations, we've not been really involved in that, apart from disseminating the information about them. But from what I've seen from a distance, the attendance has been quite good, actually. It can be quite difficult to get people to come forward to contribute to surveys and focus groups, and so it looks like there's been quite a good range of voices heard. Okay.
All right, thank you. Did that answer your question, Colin?
I'm really not entirely certain whether any specific attempt has been made to consult the views of parents and young people with visual impairment who are going through the educational service or preschool. You know, I appreciate the disruption that's been caused by COVID, but I think when there's a large-scale review of this sort, I do think that it's important to actually go out and actively seek the views of people with specific impairments, whether it's visual, whether it's hearing, or various other neurodiversities and the like. And I'm also not entirely sure this this worker on the team who expressed an ambition to be a qualified teacher for the visually impaired, whether they are being taken through, whether they are being able to train up to take on that role in the future, or whether it's going to be casework that they'll be involved in rather than as a qualified teacher.
Get a comment, Ben?
Yeah, no, absolutely. They're fair questions. In terms of speaking to people with specific areas of need, that's not something that we've done in this case. I think it's a really valid point, and certainly something that I'm going to take back for our future, for any kind of future work. I think partly sometimes it's difficult because what do we pick? And I guess certainly, particularly around those with very specific impairments and specific SENs, then absolutely, I think that's something that we can take forward. We haven't done in this case is the answer to that. But like I say, it's something that we can think about and moving forward. In terms of that specific worker, so yes, we've identified, they're a qualified teacher, so we've identified that they could be the next person to go through that qualification. We can't do anything about it at this moment because we're in that kind of formal consultation around that staffing structure. So as soon as that's finished, then we can start to identify what our next steps are around that particular role.
When you've thought about the first part of that question and decided to do something, let us know.
Well, yeah, absolutely. I mean, it's an ongoing review of a wide range of things. So absolutely, it's something that we can still build into the wider review, just not this specific work stream.
In relation to Councillor Hutchins' specific point. Yeah.
Ellen,
Councillor Rivron.
Thank you, Chair. I've got a couple of actually quite different questions, and one follows on a sense for the issues Councillor Hutchinson raised, and that is around the provision we make for visually impaired young people as they're leaving school and progressing into further education. Because obviously we're talking about young people up till the age of 25. And I wonder what specialist support is available then. I mean, I've no qualifications at all in teaching visually impaired students, but my experience as a further education lecturer is you didn't know who was going to be in your classroom. And there were some things quite basic, that, and you're probably modelling through and picking it up as you go along. Things linked to what said like things like the layout of the room. It's obvious when somebody tells you that you've got to keep that the same for a visually impaired learner so they can find their place. But it probably isn't obvious if somebody doesn't. Other things like sort of braille and maths notation, which you really require a specialist for. So I would like to know how far that specialist support is available after say post 16 into further education and beyond, because clearly we want young people to progress, whatever the other quite different question. I'm also having technical problems, so I can't actually get my agenda up on my other device. I think it was it pathway E that was around the provision of specialist provision. I think it might have been D, and I don't want you to sort of mainstream or specialist provision. I think it always needs to mean what's most appropriate for the child or the young people. But it does seem to me we're having an increasing number of young people in specialist provision, and I would always like to think whatever's closest to mainstream is the best. I'm sure, well, it could have been a lot of years ago that I remember we had about 100 places at Ravenscliffe, and that was considered large by national comparisons. So I would like to ask, is the trend to more specialist provision, and what's driving that?
Right.
Yeah, the two big questions there. I'll try and be as efficient as I can be with my answer. So certainly, I mean, in terms of our specialist inclusion team offer, we have to be really specific about when there's an endpoint to that. So it's not all children and young people 0 to 25. It's when they're in formal education, and actually that stops when they go into higher education. So we're talking about children in schools, colleges, and or if they have an education, health and care plan up to the age of 25. So what we do about that, because what's the problem is that there's not always an equivalent service for adults. And so what we do is we try and make sure that we work really carefully around that young person's transition, you know, with years in advance of that. So we make sure that there's robust plans and recommendations and bits of knowledge around that young person that can help wherever they're moving on to, whether that's university or employment or you know, whatever next steps, apprenticeships, whatever, and so that they have all the information that they can possibly have to try and make that as efficient and as a smooth a transition as possible. It's really tricky, it is, but we, you know, our services have always worked really hard around that, and it won't be any different in the new model. That's a really good question. It's something that we're really focused on. It was Stream C that you're referring to about the specialist places. Yeah. It's a really interesting question.
Sorry, I was muddling with my...
No, it's fine, don't worry. It's a really interesting question. It's one that's really close to my heart. I'm a firm believer in inclusion in mainstream school, as long as that is appropriate and as long as that's what the parent wants. And I will always try and do everything to try and accommodate that where a parent wants their child to be educated in a mainstream school, because it's the law. It's absolutely what, you know, what we're supposed to do. You're right, there is a trend towards more children in special schools at the moment. That's not just Calderdale, that seems to be across the country. We've always been in Calderdale has always been really high on the inclusion scales. So we've always been within the top 20 of authorities, or around the top 20 when ranked in terms of inclusion. And inclusion is measured as the number of children in mainstream schools as a proportion of the overall population. So we've always scored highly, and I'm keen to keep that high. Some of the factors that are affecting that are much wider than SEN. So things like the academy agenda, I think, contributed a lot. Funding reforms in schools is a tricky one as well. Schools are having to do a lot more with a lot less. And I think sometimes that means that there are less other support mechanisms available. So sometimes parents feel that mainstream isn't the right option for their child, perhaps sooner than they would have ordinarily done so. There's a lot of competing priorities, a lot of difficult factors which are, as a whole, contributing to this idea that perhaps specialist schools are more appropriate for some children. Like I say, we believe in the rights for children to attend mainstream schools where possible. So we've really invested in that. We've tried to create some resources and literature for parents to look at what the benefits of mainstream inclusion might be. And it's something that we're really focused on. Interestingly, you said Ravenscliffe, you were looking at 100 places. So we've currently got 223 in Ravenscliffe. And we've got another 215 in our primary specialist sector as well. So we've certainly grown in terms of special schools, but also we've grown as a proportion of the overall population in special. So it is something that we're very mindful of, but one that we are being proactive in terms of trying to address.
Happy Helen.
Well, I think that answers the question. I thought there were a lot of other trends beyond specific specialist provision, and I know we're not going to answer that one for tonight, but
before I know we've got a lot of members waiting, but what you said there, Ben, would seem to be contradicted on page 9. It's a request for specialist placements in Calderdale continue to rise disproportionately and against national data trends. And yet you seem to have just poo-pooed that in the answer to Councillor Ridwan's question.
So last year, because of COVID, there was a reduction in the number of children who were looking at, well, I'm not, it might have been because of COVID, but there was a slight reduction in the number of children who were wanting to go into special as a proportion versus mainstream. We actually were against that national trend and had more in special. But as an overall trend, when you look back in years like 2014, 15, 16, the overall trend is much more towards a specialist agenda rather than a mainstream. But in the last couple of years, we have disproportionately increased our number of children in special schools against the national trend.
So why?
It's a good question. I'm not sure. We've had rising exclusions as well.
Sorry?
Sorry?
Stick to the point. Why? not exclusions, especially school-wide.
Well, I think it's all related, isn't it? If exclusions are very related to the inclusion of children with additional needs and complex presentations, so it's all interrelated. I think one of the things that we struggle with is that the local authority control of schools has reduced. 100%, I think, is it, of our secondary schools are now academies, which means that we have less control over different kind of behaviour policies or inclusion policies that are in existence. I think we've had a gap in services over the last couple of years. I think we've probably taken our foot off the pedal a little bit, which we're keen to, which is what the SEND review is addressing, really. So I think probably a lot of that has contributed to our disproportionate increase in special schools. But like I say, it's something that we're proactively looking to tackle.
Thank you. I've got lots of members waiting, but Colin, if you want to be quick. Councillor Hutchinson.
No, sorry, I wasn't looking to come back in. I'd had a chance to ask for clarification. Thanks.
All right, okay. Councillor Tremaine, Diana.
Yeah, I think mine's not too complicated, so you'll be relieved. I was just interested in my sort of professional background in the kind of training and support for teachers, and so that section, and kind of concerned that there hadn't been much networking going on before, but relieved that there's obviously been quite a lot of action on that. I'm pleased as well to see that there's a good mixture there of formal and informal opportunities. But just thinking in terms of, you've got a conference coming up and you've got your sort of anticipated outcomes, and kind of where you're at in terms of that, and how you're going to get that full engagement or bigger engagement really from the teachers who perhaps aren't appreciating the opportunities that networking is going to bring, because it's a hugely important thing, I would say, in terms of developing practice.
Yeah, again, a very good question. I think at the moment we're actually focusing on SENCOs, which are the single. Well, in most schools, it's a single identified person who's responsible for coordinating their SEND provision. But actually, I think you've hit the nail on the head, whether you intended to or not. But actually, it's the teachers that we need to really upskill and train and be passionate about SEN. The new laws that came into place in 2014 says that every teacher is a teacher of SEN, and we firmly believe that. And it doesn't make any sense to us having one person in the school who knows what they need to know about SEN. And so we're looking at different mechanisms that we can put into place for teachers as well as for the SENCOs. So we're hoping that there's a kind of fluid model where the SENCOs will actively train and support and coach their teachers. But also we want to make sure that there are elements in place for teachers to join us as well. The same as with our SEN governors, for example, as well. So we're doing a really robust training model for our SEN governors. And actually, crucially for us, we've identified that the majority of time that young people spend in school is often with a learning support assistant or a teaching assistant, who are often the least paid, sometimes the lowest qualified, and have least access to continuing professional development. So another tack that we're taking is trying to come up with training modules and programs which are really focused on upskilling learning support assistants and teaching assistants, so that they have the capacity and the skills to be able to respond to what they're presented with on a daily basis. It would be impossible to train everybody in autism and everybody in visual impairment and all of the different varieties of SEN and complexities that our children and young people present with. So we're trying to come up with a model that means that they're best able to respond to the child as they're presenting, and just really try to know that individual child well, rather than, oh, well, you've got autism, so you must behave or respond in this particular way. It's about knowing the children well and knowing what makes them tick and what hooks them into their learning.
That's great, thank you.
Okay, good. Sarah.
Hi, yeah, you've sort of partially answered a couple of the points I was going to make, so that's great. So it should be a bit quicker. So the first, I was just going to make a comment about, you doing anything around SEN governors, but yeah, you've already mentioned that, so that's brilliant. The second thing was just about, what provision have you got really for, so your specialist staff, are you building time in for them to be able to do training, to go into schools or wherever, or even into colleges where people are doing their initial teacher training? I know that even with the teacher training courses, there's very little college time now. It's mostly done in the classroom, but like to be able to influence that, because I know that. So a bit of a I used to work what was Thornbury Bridge High School in the ASD provision there. So I have quite a lot of experience in this area, and I know that a lot of my colleagues, and in fact I myself, did a lot of putting on training for other colleagues in mainstream schools, because I think, we know that teachers are under a massive amount of pressure. We know that there isn't the same funding for support staff that there used to be. We know that, to get an EHC plan is much more difficult than it was to get a statement, and then there are no longer the sort of like the other steps up to it that would attract some level of funding. We know that all resources are really pinched, and obviously teachers are having to be SEND teachers, as you've mentioned, but I think very, very small changes, as Helen mentioned about, as Councillor Riveron mentioned about, if you once you know it, and then you can always, there can be some really, really good little bits of practice that teachers can put in without a child needing to have an EHC plan or any sort of statement or any sort of even concern. They can just observe a behaviour and then know an intervention to put into place that can really help nip things in the bud, or to help support that child to be able to access the curriculum, so then they're not getting bored and end up excluded, and so things escalate. So how are you going to build in provision for the specialist staff within across the sort of board within the department to be able to have time to do training and to deliver training, and to develop more training materials that are easily accessible? There isn't a quick fix, and we don't have a magic wand, but that I really think that can be such an important step for young people to have a little bit of a tweak by someone who isn't just necessarily a professional, a big scary sort of professional from a big plan, but just their normal classroom teacher or the normal classroom assistant, to be able to put something into place that can really have a massive positive effect. So I just want to know, are you planning that in for your staff to be able to do that sort of thing?
Yeah, so we already have a reasonable training offer, I think, for a variety of needs. And one of the things, for example, you mentioned autism. We're looking at a collaboration with two national bodies moving forward. I don't know if it was in the report actually, because it wasn't part of the SEND review. It was just an aside piece of work. We're looking at partnering with the Autism Education Trust, which provides a framework of training and expectations and development for schools, so that it really creates that resilience and accountability within a school before they get to that specialist and targeted level. So actually what we're really trying to do is upskill teachers and staff at that universal level, so that actually most children's needs are met most of the time. But yes, certainly there will be opportunities for people to engage with training. You mentioned ITT, which is initial teacher training, and particularly teachers on their early career framework as well. We're trying to link in with providers of those training services, so that we can really get there early as well. New head teachers as well, we're linking very effectively with the school effectiveness officers, so that new head teachers and new people to the authority can understand what our offer is and how they can access further training. And there was one other thing that I was going to mention, and I can't remember what it was. It'll come back to me.
That's great, thank you. That's great.
Just let us know. Sarah, have you finished? Okay, finally, Danielle, we've got to you.
I don't think it is finally, Chair. I think there's a couple
No,
more.
it's not finally, but it's just finally we've got to you. I was talking about you personally.
I'll just have to go on to my Modern Gov, so I might come off screen, but I've got a couple of points, if that's okay. First of all, I was going to ask, throughout the literature that you've sent, you've referenced families and stakeholders. I just wondered why why families are not considered stakeholders throughout, because I would have thought they was one of the most important stakeholders within some of the points that are raised. Secondly, sorry, Chair, am I okay to ask?
No, carry on.
Is that okay?
Yeah.
There was another point around the EHC assessment. Oh, and I will just say, by the way, I've got 2 children with SEND. I should just declare that. There are something around the EHC assessment plans, and it was made a comment on that they don't always go to tribunal because it's been agreed before the hearing. And I was just wondering what the difference was, because I think it was referenced that there was training for the panel around the refusal, so that there was less that was taken further. But I was wondering if there was a particular pattern or a thread of why they've been agreed, not necessarily at panel, but then before hearing, and if there's any learning that's been made from that. Sorry, I just need to go to my little points on ModGov. It's quite new to me, so I've put some annotations in there. The next one was, I was really impressed to see the comment around the lack of SEMH provision, and I wonder if we had any plans how we can meet that better. And then finally, there was lots about increasing capacity in specialist provisions. And again, I'm like Councillor Rivron, I do believe wherever possible, mainstream's ideal. There was a question I wanted to ask around, we know that local authorities hold responsibility for all children that are SEND and the schools don't. And I'm just wondering how we can improve, I guess, their inclusive policies, because it's not around policies being inclusive, it's around them meeting the law of equality. You know, that is a law. It's not just around what should be done, it's what has to be done. So I wonder how we can manage that. I'm glad that Ben did comment on the academy framework, the academy process being a challenge, because I think that was something I was going to ask, so that's been covered. And the last thing was, there's lots around specialist provision being increased, but not very much post 16. I think there is a lack locally. And I just wondered around, particularly that really uncomfortable age between 18 and 19, if they're not necessarily within a specialist provision, and what's being considered around that. And I think that's everything. I'm not sure if I've made sense before then with all that, because it was a bit of a spider web. Sorry.
Give it your best shot, Ben.
Yeah, no, it absolutely makes sense to me, Councillor Durrance. Thank you. I'm just going to start with one of your latter questions first, because actually it reminded me of what I was going to say to the previous councillor. You talked about increasing capacity within mainstream schools and about their inclusive approaches. So that was the other partnership that I was going to mention. So we've been chosen. We're one of 3 authorities that are working in partnership with a national organisation called the Centre for Studies on Inclusive Education. And it's a research-based organisation. They work with the University of Bristol. It's got a really fantastic reputation for inclusion. And they're working with us to do a research project about how to better include children within their local mainstream community schools. So that's got three parts to it. One is working with parents so that they're aware of their rights. They're aware of the kind of human rights agenda around children and young people in their local community schools. One is working with inclusion champions in schools, so they will identify and train a range of inclusion champions, which can then work with other schools. And the third is to work with local authority staff, so that our policies, procedures, processes, even our informal discussions with parents and things lead to that sense of inclusion. So that was one of the things that I wanted to come back to. So it's really exciting work that we're undertaking from January with that group. So you asked about, we talk families and stakeholders. Absolutely, families are our biggest stakeholder, if not the child or young person themselves. I think I referred to it as that in the report, just to assure you that I'd included families within that scope. So it wasn't to distinguish them, it was to make sure that you understood that we had considered them as part of that. In terms of tribunals and EHC assessments, so I think the question was, why are some agreed before tribunal? How do we get to that? And what are the kind of patterns around that? So I've done a lot of work on this actually over the last month or so. And whereas we've got a lot more tribunals at the moment, we're getting to the hearing stage in much fewer circumstances than previously. So whereas before we'd only have a small number, 4 or 5 or 6, actually 100% of those would reach a hearing. Whereas these days, although we have a lot more tribunals that we're dealing with, which again is the same as other authorities across the country, what we're finding is that we're able to find compromises, and we're able to talk to families about what their expectations are, and try and find ways to work with them to reach a compromise before a hearing. So either that means that they are satisfied with our approach and want to withdraw the hearing, which has happened in a handful of cases this year already. Or it may be that we agree by consent, which means that we've agreed to some of the aspects of it and the parents are happy with what we've agreed to, and they're happy to leave it at that. So there are a lot of things that we're doing with families who are dissatisfied with our services to try and find a compromise or a way forward that is mutually agreeable. So so that's why some of them are able to be agreed prior to a hearing. Yeah.
Sorry, can I just clarify that? Agreed not to assess or agreed not to issue a plan?
All sorts of tribunals. So at the moment, so we've got a variety of tribunals around either a decision not to make an EHC assessment, an education, health and care assessment, a decision not to issue a statutory plan, or a decision around the contents of that plan. That's also something that can go to a tribunal. If we decide to finish an EHC plan, that's also something. If we decide not to amend it on an annual basis, that's also something that can go to tribunal. So there's all sorts of different things. And in most circumstances, we're able to agree, we're able to find a way forward with a parent. There have been some where there's been a decision not to make an assessment, for example, and we've able to explain to the parents why that's the local authority's position, and they've agreed, and they've either withdrawn the appeal, or we've agreed that actually they have some information that we weren't aware of, and we've been able to compromise on that in that way.
Can I just ask one more question, Chair, if that's okay? It's linked to that. The next question was, are we finding, particularly because of what your comment around challenging policies and exclusions, and I agree with what Pete said, often what's perceived as behaviour, and it's not necessarily that they're recognising need early enough. Are we finding that parents are then being forced to apply for an EHC because needs are not being met appropriately at school in order to get a more suitable setting, or have we not got that information?
Well, I mean, I think it would be impossible to get data around that without interviewing every single parent in that particular way, and I'm not sure that would be appropriate. But absolutely, as a theory, I would agree that that's probably accurate. Forced is a difficult word. I would say that perhaps parents sometimes
have no other option.
Have no other option. That's exactly what I was about to say. Yeah. So I agree that's probably something. I'm just going to follow that up with an answer to one of your other questions around social, emotional and mental health difficulties. So children who have difficulties regulating their emotions can often present with difficult behaviours, which can be tricky for schools to manage. So we've got an underdeveloped provision for children with social, emotional and mental health difficulties in Calderdale. And so we're looking at tackling that in a few different ways. We've got really positive partnerships with our specialist provision cluster, which are our special schools. Part of that specialist provision cluster is William Henry Smith, which is a non-maintained special school for children with challenging behaviours and with SEMH.
Sorry, Ben, for boys.
For boys. So they're helping with strategies and kind of triage sessions for schools. They're helping to go in and make recommendations around some of the supports and systems that they can put into place. So we've got really robust mechanisms with those. For our children in primary school, we have established an alternative provision trial. So we're trialing that. It's for children who are in Key Stage 1 and 2. And children can come away from their school for a period of up to 16 weeks where they'll get really intense therapy, support and teaching. And the organisers will also work with the school to really help that reintegration and that transition back into school as well. So we're doing a lot of different things around that. I don't think there's any kind of silver bullet that we can pull on for children with social, emotional, mental health difficulties, but it is something that we're constantly thinking about and reassessing. Our work stream around alternative provision will help with that. I think it's stream E off the top of my head. So I'm hoping that will be helpful.
Is there any chance that, I mean, William Henry Smith and what they offer is a very good offer, I believe, and the skill set that they have. And I did know that they offered it further out. I just wondered if there's a chance to replicate that on a more balanced provision for both genders, or if that was not being considered, because what they do works really well. But sadly, not sadly for the boys, but it's for one gender. I just wondered if that could be considered for both in a more inclusive.
I mean, For William Henry Smith itself is a non-maintained school, so we don't have any kind of control or influence over that. However, it is only one school, and we have a broad range of schools that we use to support children with social, emotional, and mental health difficulties, all of which, I believe off the top of my head, all of which are for both genders, rather than just William Henry Smith. So we do have a broad range of providers.
Are we, sorry, Ben, I'm really sorry, Chair. Are we talking more about, I think I'm thinking more proactive than reactive. Are you talking more about the pupil referral offer, or am I on a different?
We've got lots of different schools that we use for children, to accommodate children with quite challenging behaviours and presentations around social, emotional, and mental health difficulties. So we have a range of providers that accommodate children, with a broad kind of range of needs and both genders.
All right, thank you.
Okay.
Thank you.
The only thing that I haven't answered was around the post-16 provision. So we are looking at working with the college to create some kind of element of partnership work between Calderdale College and Ravenscliffe, if that's something that we can try and move forward with. But again, yes, you're right. It's a bit of a gap. It's something that we're looking at. One of the streams that we're looking at moving forward is around preparation for adulthood, and I imagine that will incorporate some discussion around what options there might be for children or for young people who are post-16 and post-19.
Thank you.
Before I move on to Councillor Smith, there is a point in your paper about SEMH in that Calderdale is uncommon compared to other authorities, as though we don't have a maintained specialist provision. Why is that? And is it a good thing or a bad thing?
Why is that? I wish I knew the answer. I'm afraid I don't know the answer to that. We don't have any maintained schools which are specialist around social, emotional, and mental health difficulties. Most authorities would have at least one special school, which was either an authority school or an academy for that range of needs, and we don't, and I'm not sure why. But actually, we use our independent sector really well for that range of needs. So actually, we've got maybe 8 or 9 or 10 local special schools who are really highly specialist in that range of needs. And actually, when you look at although the placements themselves are slightly more expensive, when you look at all the on costs and the building and the estate costs, actually it probably works out as a bit of a balance. So it's not something that I'm overly worried about.
Okay. Councillor Smith, Audrey.
Thanks, Chair. Yeah, my question is really sort of on those lines. Is it fair to say that alternative provision is inclusive because it covers everybody, or not? Is everybody who's excluded from school referred to alternative provision?
So the council's duties on exclusions are that if a child is permanently excluded, we have to provide provision on their 6th day of exclusion. And so at the moment, we only have one provider of that 6th day provision in Calderdale, and so that's the Whitley Alternative Provision Academy, so what was previously known as the PRU, and that's the reality at the moment, is that we only have the one provider. We are looking, as part of our alternative provision stream, whether or not that's sufficient, both in terms of capacity and sufficient in terms of variety. So I think it's a very good question, but I'm afraid I don't have the answer to that yet. It's something that I'm hoping we'll be able to answer once we've got the review of the alternative provision done.
Thank you.
So, Councillor Holdsworth. Maybe she's gone for a gin and tonic. Councillor. Oh dear. No, not there. All right. Colin, did you want to finish off now? Have you actually finished?
No, I've finished, thanks, Chair.
All right, okay. I'm going to give Sue one more call. Hello, Sue. Oh, it's changed on my screen. No sign of her. All right, I'm going to say, oh, Adam. Of course you can.
Thank you, Chair. I just thought it was just worth acknowledging as well that as well as the sort of local review that we're doing, there is a national SEN review underway. And I spent 2 days at an LGA event last week, and we spent about half a day on SEN with some of the sort of leading sort of experts in the field. And I've never heard people being so blunt really about how nationally the system's just not really working as well as it should be doing, and that sort of trust, you know, with some families is at an all-time low. And I think, you know, COVID really exacerbated some of the challenges that a lot of the families were facing as well, and all those things that have been said about the school system currently just not really being set up, mainstream schools, to sort of get the best for these families, were sort of things that were being mentioned last week. And the independent chair of the guys who were doing the review was at this course, and he was saying that mainstreaming and inclusion is going to be sort of one of the key themes of the review when it does report. So hopefully we will sort of see some change as a result of it, and see sort of mainstream schools being more equipped and geared towards delivering for these families that, you know, in some cases are really struggling to get the provision that they need. And I'm sure that when this review finally does report, because we've been waiting a couple of years for it now, I'm sure that whatever it says will feed into what we're doing on a local level. Thank you, Chair.
Thank you. Ben.
Yeah, thank you. Just to respond to that, I was going to say, he didn't give you a date, did he, of when we're expecting the report? Because it's really difficult for us to try and set a direction that we don't actually know where the destination is. But I think we focused on the right things. We're really focused on inclusion. We're really focused on mainstream as far as possible, and we're really focused on that listen first approach. So not doing things and then asking for, you know, whether it's right. We listen first and then we act and then we check. And I think that's going to be key in the SEND review. So I just wanted to highlight that. The other thing I just wanted to say, I didn't want to leave without saying, I feel like I've almost given our schools a bad rap. Absolutely, there's a lot of things going on for our schools, which puts them in a difficult position to try and be everything to everybody. And certainly, you know, we've got really good relationships with our academies, and our secondary schools in particular are really innovative and really focused around doing different things and doing things differently. And that's fantastic, and we work really well with our schools. We're trying to give them as much support as we can to try and make them as inclusive places as they can be. Thank you.
Councillor Ellsworth, Sue.
Thank you, Chair. I'm afraid this question relates to some comments made further back in the discussion. It was the point made about the growth in special schools and exclusions. And I wondered if this was related to the point that schools are supposed to attain in terms of exam success. So is the rate of exclusion related to removing children with special educational needs who may present with behavioural difficulties, and the growth in the numbers of students at special schools a way of moving people out of the picture of success that schools are supposed to present in order to achieve?
I think that question is, do we believe that schools are fiddling the figures?
I think it's a really interesting one, and I could talk for hours on it, but I won't, don't worry. I think,
no, please don't.
What's really tricky is that, so it's the authority's decision. So for children in a special school, they have to have an education, health and care plan, a statutory document that only the authority can provide. So it's always the authority's final ultimate decision about whether a child is in a mainstream or a special school. But the problem is that by the time it gets to a point where we're having that discussion, a parent is often absolutely they feel one way, very specifically one way or another, because they've either been pushed to that limit or they've not got the support that they anticipated or expected, or that they feel that their child deserved. And so sometimes by the time we get to that point where the local authority is making a decision, it's often too late to be able to explain that with any kind of credence to a parent who's already kind of fought for a long time about getting the necessary support. So I don't necessarily think it's about schools fudging the figures at all. I think it's a long and difficult journey for children and families, and it can be difficult for schools as well. And I think sometimes that just comes to a head where it's difficult to know how to take steps forward. And so we're trying to offer alternative solutions to that step forward than just looking at special school. So we're looking at our alternative provision, we're looking at our specialist support, we're looking at other options, not just special schools, but those halfway houses, so our resource provisions and our SEN units in mainstream schools, just to make sure that we're not always automatically defaulting to the most specialist option.
Thank you very much.
All right, members, there's nobody else asking questions. So I'm going to bring this to a halt. I'd like to thank Ben and Pete. You got quite a grilling tonight, Ben. I thought you handled it quite well. It's obviously a very complex situation. And there's obviously a lot of progress yet to be made. But I feel as if we are trying. I take on board Councillor Wilkinson's comments. I think we'd all like more money, wouldn't we? But the money's not going to be any good unless we've got an organisation and the right targets in mind. And I hope that's what we're aiming for. All right, thank you very much, members. We'll move on.
Thank you, everybody.
Thank you. Thank you, Pete. Ben. All right, members, we gave that a good go. Very interesting. Item 7, pathways. Yeah.
Thank you, Chair. This is an update report. Members of Scrutiny will know that you've had a couple of updates on the Leaving Care Service, which is known as Pathway in Calderdale. That was commissioned outside the council and delivered by Prospects, and we made a decision to bring that in-house earlier in the year. So this report is an update report. So Lucy's going to give you the highlights of the report and take any questions. So I'll just hand over to Lucy to introduce herself to you. Thank you.
Thanks, Julie. Hi, everybody. So I'm Lucy. I'm the service manager with responsibility for the Calderdale Pathways service. I'm assuming everybody's read the report, so I won't go into it in great detail.
Oh, don't, Lucy. We have read the report, I can guarantee you.
Super.
I believe we've understood it.
You even understood? Oh, good. So I'll just give a few headlines and then just open for questions, if that's okay. I wanted to start by acknowledging that this week is National Care Leavers Week. This is where, as a country, we celebrate the achievements of people who are care experienced. And at the current time, our Pathways team are hosting an awards event at the Orange Box. It's half online and half live because of COVID restrictions. But we're celebrating some of the achievements of our care leavers. And I think all the awards will have been announced by now, so I don't think I'm revealing anything. I think the person who won the overall award for achievement is a young woman who's in the second year of her social work degree, which is brilliant. The event has been planned by care leavers. They've hosted it, they've prepared all the food, cooked all the food, they've provided the music and so much more. So we're feeling very proud of them at the moment. Some of the other headlines from the report along the same topic around socialisation. We've moved to the Orange Box, which has been a huge success for us as an organisation. It's very quickly allowed us to make better connections with colleagues who offer services for people of the same age. And it's the start of a care leavers hub somewhere for care leavers to go and drop in if needed. As the report identifies, we're hoping to grow that. It's very much in its infancy at the moment, but the plan is that, that it'll be somewhere where care leavers can access services. So we're getting as many partners as we can on board to run surgeries or to base themselves with us, depending on the service. We've also connected with Kirklees Council this year to arrange a Christmas dinner for care leavers who are isolated. Because of COVID, it's not quite what we want it to be. In years gone by, Christmas dinners have been actual events where young people are brought together at a venue. This year, we're still delivering Christmas dinners with gifts to care leavers, but hopefully in future years, it'll be a big event where care leavers who don't have anywhere to go, sorry, my voice is going, they would be able to come to the event. We've also just moving on to staffing, we've increased the staff team since it was brought in to Calderdale. So we've got one additional pathway advisor and one other person, like an enrichment post, where they'll be complementing the work of the Right to Voice service, the Children Care Council, by putting into practice some of the things the young people want us to do from a socialisation and enrichment point of view. So that we're in the process of recruiting. We've recruited the additional PA, but they haven't started yet because we're just waiting their formal checks and notice periods. And we're in the process of recruiting a full-time practice manager. So the team is going to be more well equipped than it has been. We have also the staff team are undertaking systemic practice training, which is the model used by the wider children's services on supporting young people. It's not something that the Pathways service were part of previously, so they're all really keen to do that. And we've also started having what they call regular pod reflect meetings, is where the team talk about young people where they're perhaps a bit stuck and they need a bit of guidance and support. It's taking a team approach. Those are just some of the headlines. I don't want to keep talking if there's questions, so I'm happy to stop there if that's okay.
All right, I have one or two really quick questions. We like systemic practice, this board. When do you imagine that system will be embedded? I'm going to give you all the questions at once, Lucy, so just write them down.
Oh,
When do you think the systemic practice will be embedded? How many Pathways clients do we have? And what percentage of those do you think are attending the Orange Box in our drop-in system? And if it's not a great big number, what do you expect it's going to be in the future? And finally, from me, I think, how are we going on by identifying specific tenancies for our that are going to be ring-fenced for our care leavers? So 3 quick questions there.
So systemic practice, the training starts next week. I'm on it. I'm very much looking forward to it. Embedding is more around how the team are supported to maintain their learning. And I'm part of a working group that's separate to the Pathways service. It's part of Children's Services, looking at how we embed systemic practice across the service so that it maintains momentum when there's new starters, and allows people to have constant refreshers because it's part of their practice. So I won't make commitments on embedding it, but in terms of it being widely used, I think that should be fairly instant and quick. I think it will rely on the practice manager, who's we're in the middle of the recruitment period for that person. So if we recruit somebody external, then we'll have to ensure they're trained quite quickly and supported. But we've got a member of the Calderdale CTS team supporting us. So that's a big bonus for us in terms of getting everything, getting it embedded and used regularly. In terms of how many care leavers, I'm just frantically trying to find an email that gives me the exact figure, but it's roughly about 150. It's really difficult to have people regularly attending because of COVID. So we haven't been actively encouraging attendance up until probably the last 3 or 4 weeks, and that needs to build. I honestly don't know the answer to your question, but I know that it's not going to be 150. It's going to be a lot more, a lot less, and we've got to keep working on that. But we've got to work on it in a COVID safe way, because of the other services that are there already. There are some young people who have been accessing it, so for those people it's easier. It's not a massive transition. For young people who aren't accessing services there already, we need to start thinking about the events that we put on regularly, so generally social events, cooking lessons, movie nights, that kind of thing is what we want to work towards when it's more safe to do so. Does that answer the first 2 questions, or do you want any more information?
No, that's fine so far.
Okay, the final one, the specific tenancies, we're working really closely with our colleagues in housing to put together the care leavers protocol. Unfortunately, due to sickness, it hasn't gone as quickly as I'd liked, but it is a joint care leavers protocol is a requirement of the DfE, where housing work together with the local authority to agree a minimum standard of what care leavers should expect. So it's in existence in terms of the agreements that we've already got with housing, but we're trying to build upon that so that it's a lot more robust, and that it includes colleagues from probation services and health services, so that, you know, when young people are leaving custody as an example, we're supporting them into appropriate housing in a timely way. So there's work to do on that, but that's our route to working with our partners. Is that what you meant?
That's exactly what I meant. So
yeah.
A work in progress is how you describe that, was it?
It's definitely a work in progress, but it's a work in progress where everyone's on the same page, if that makes sense. So it's just about bringing us all together and getting it.
Well, they're the best kind.
Yeah.
Let us know when you've done it, Lucy. Yeah.
Absolutely. Yeah.
Okay. Thank you, Sarah.
Sorry. Yeah. Thank you. My question was just very quickly, and I have looked through, and I don't think it's just a really quick question on the graph that's on the top of page 6, which is the percentage of 17 to 18-year-old care leavers in education, training, or employment. There's a really big dip in 19 to 20, and then it comes back up again. I just wanted to know if we sort of knew what that dip was caused by, whether it was COVID related or not. And it's great that it's come back up again, but it's just in terms of being able to then, know what happened and help protect against those sorts of things that things happening again. So I was just wondering if that's known why that dip was.
There is we don't know exactly, but the COVID has had a huge impact, and it's had a huge impact across that age group, 16 to 25-year-olds, and that's the very likely reason. But we're not taking that for granted. We've got a little working group that started that is including colleagues, including Ben and the virtual school. We're hoping our local colleges will get on board so that we can look at, and some young people, so that we can look at what the challenges are for young people accessing education at that age, and why there is a bit of a drop off generally at 18, what that's about. And again, that is a national picture for young people. It's not care leaver specific, that dropping off at 18, because when young people go to college, often things take over from learning, and it can become less of a priority. So we're looking at how to support our care leavers to maintain education, training, or employment, support them to as far as possible pick the right college course or apprenticeship, etc., so that there is less likelihood of young people dropping off at that age, and making sure we're getting the basics right. They can afford to get to that venue, the college, whatever it might be, and that they've got the right clothes. And we're looking at things like, and we haven't got this yet, but we're looking at things like mentorships, so that those people that will need somebody to hold their hand a little bit more than others will have that support. So again, it is a work in progress. It's only been back in house roughly 6 months, so we're trying to do a lot in a short space of time. But the motivation is there, and it's already in process. We've got a meeting set up to get the ball rolling with looking at those issues.
Doing a lot of short space of time. That's what we like to hear. Danielle.
Fine.
Thanks, Chair. Just a quick question about the Christmas dinner for people that might be isolated, and COVID meaning that's delivered to their homes. I just wondered if that's possibly flexible and may change. I'm just thinking after the couple of years, more isolation at Christmas might impact them further. And if we're having events like we are at the Orange Box now, managed in a different way, if that was a possibility as well.
Yeah, the event at the Orange Box, I think we only had about 15 people there. It was really quite a smart. We did it online as well. So
that was one of my other questions. Sorry, Lucy, I should have said, is that a really high take up, and is numbers one of the reasons it might have been the decision were taken? Sorry, I should have said that.
About the Christmas dinner or the what event?
The Christmas dinner, is it a lot of people that would attend that?
Yeah, to be fair, there's a reasonable number, and again with the event at the Orange Box, I think our original plans were for 60. So there is a desire for young people to get involved. I feel like we're doing what they want us to do, not just doing things for the sake of doing it, if that makes sense. This is what young people are asking for. I don't honestly think it will change this year. I'm not arranging it, and I'm not directly involved with the arrangements. But my experience previously is the cost of the hire of the room and the prep and the getting all the staff there to do the cooking and everything that needs doing. The volunteers, I should say, not staff. It's very much based on a volunteer-led programme, and there are a lot of willing volunteers, which is wonderful. And there'll be a number of volunteers out on Christmas Day delivering and hopefully cheering people up and having chats on doorsteps and things like that. But to arrange all that for it then to be cancelled at the last minute is a huge challenge. So I think we're erring on the side of caution this year. But I hope that as of next year, it's back to business as usual. We're also talking about what we can do. Maybe in the spring. I think we're being really optimistic about the situation with COVID. I'm really hopeful, and we're thinking about doing an event in the spring that's just a massive celebration of we can see each other again, we can have a hug, we can get back to a bit of normality. But we're not putting the wheels in motion for that until we know. We don't want to set something up and then cancel it. So, but it's in our book, if you know what I mean. We're planning it quietly.
Are the young people happy as well that with the hamper idea and things that it?
Well, I'm sure they'd prefer an in-person event, but yeah, it's a good alternative.
Thank you.
Councillor Monteith, Brenda.
Yes, thank you, Chair.
You'll have to unmute yourself, Brenda. You must have tried, but you there you go.
Oh.
There you go.
Yeah, my comment was that I felt it was unfortunate the awards event was the same evening as this scrutiny panel was, because I would have liked to have attended the awards event, but it was. I know these things can't always work out well, you know.
No, I agree. I would have liked to have been there as well. There's lots of reasons. We did.
Yeah, because I mean, a lot of councillors on the Children and Young People's Scrutiny Board would ordinarily wish to attend a Care Leavers Award ceremony.
Yeah, I know, it's a real shame. We did try and move it to the Tuesday, well, to yesterday, but for a number of reasons it just didn't come together, and we had to leave it to the Wednesday. But I absolutely agree. I would have liked to have been there too.
Well, I'm sorry we kept you from it, Lucy.
Oh, no, don't worry.
Well, you sound like you're a bit of a cold. Are you all right?
I've had it for
It's
about
okay.
4 weeks now. It's never ending, so you've just got to battle through, haven't you?
Oh dear. You've got a long cold.
Yeah, I've got a long cold, yeah.
There's nobody else asking. Thanks for the report. We're very interested in pathways at this board, but I think we're going to leave you alone for a bit now.
I really appreciate that. Thanks for having me.
There are some really good stuff in here. I particularly like the 2.8.3, brilliance with colleague and partners, etc. Very good. The apprenticeships, we're keen on that. Suitable accommodation, 100%. We like that. Yeah, we like it. We progress, and as I say, we'll probably leave you alone for a bit.
No, that's great. I hope next time I come, I can tell you more about what all those promises we've made being in real.
Yeah, we like outcomes, Lucy.
Yeah.
Once you get the process sorted out.
Thanks very much.
All right, thank you very much.
Bye.
Right. All right, members. That was really good. I like reports that not too complicated and don't make me unhappy. We'll move on to item 8, virtual school. And for the 5th time tonight, Director.
Thanks very much, Councillor
Raystrick. I'm joined this evening for this report by Parveen Akhtar, who's our service manager and virtual school head, and she's going to just give you some highlights from the report and explain her role to you. It's been a bit of an unusual year, as you know, for examinations that haven't taken place, and a lot of things have had to be on predicted grades, and it's the same for our looked after children. So it's just to have that as a bit of a health warning at the beginning of the report. But I'm going to hand over to Parveen to introduce herself to you. Evening, Parveen.
Evening, Julie. Good afternoon, good evening, everyone. I have sat through since 6 o'clock, so I'm quite aware it's been a long meeting. So I'll start off with introductions. I'm Parveen Akhtar. I'm the service manager for vulnerable learners, and I'm also the virtual school head. Very similar to Ben, the virtual school head came into my management portfolio in January this year, so 10 months into the post of leading the virtual school head. Doing the virtual school head role and leading the virtual school. I'm going to start off with a bit of a context just to explain what the virtual school is and what the virtual school head's roles and functions are, and then I'll provide the highlights around the data, and then I'll open it up to questions if that's all right, Councillor Raystrick.
I mean, keep it brief. We've read everybody's read the report.
Fab.
So we all know.
Okay, thank you.
Just the highlights.
Okay, fab. So obviously the virtual school is a statutory function of the local authority, and it's for the local authority to act as a partner / champion, I would say, to promote the progress and educational attainment of children and young people who are or have been in care. So they are able to receive a high quality education and achieve the best educational outcomes that are comparable to their peers. I've been asked this before when I've done elected members briefing sessions, particularly new elected members. Where is this school? So the school doesn't exist in real terms or as a building. Children do not attend it. They remain the responsibility of the schools that they are on roll at. So I'm just getting that in because I know when we did some new elected members training, I was asked that question. So what's my role as a virtual school head teacher? My core purpose, I suppose, is to be really relentless in driving up the improvements in the progress that our children are making within their education, for those that are placed within authority, but equally for those that are placed out of authority. So that's kind of the context. The main headlines, and then I'll open it to questions, are early years outcomes are strong in most measures and overall better than the regional and national looked after data. other than one area, which is a good level of development, and that's a summative assessment, where children at the end of their early years foundation stage are measured against those attainment area. Our other key good line news is performance at GCSE has shown significant improvements in the number of students who've achieved 5 or more passes at GCSE level 4 or above, including where maths and English is included. So strong, fairly strong at the bottom end in terms of early years, fairly positive news at the top end in terms of GCSE outcomes. And the area where I have got concerns, or we've got concerns, have been identified in the primary teacher assessment data that we requested during the summer term before schools closed, which does evidence a decline in the performance within this phase, particularly within writing in Key Stage 1 and 2 and in phonics. I suppose, and also this further highlights the significant contributory factor that the two school closure periods have had on our children looked after. So they're the key headlines, and I'll open it up for questions.
Thanks, Praveen. I think members are very much aware of the overall effect on vulnerable young children, but my first point, I'll go to it earlier, regards what we just talked about SEND and the rising number of exclusions and the various difficulties around that. In 2.8.3, I'm going to give you a chance to pull yourself up here, Praveen. No looked after child has been permanently excluded, and yet exclusions are, I won't say they're going through the roof in Calderdale, but they're certainly going up. Why is that? Are we just really good at looking after them?
Okay.
Is that what you're going to say?
No, it's a really good question, because within the local authority management portfolio, the exclusions that are increasing are also within my management portfolio. So I'm not going to touch on that because that's my other hat that I wear. And you're absolutely right. Those exclusions are rising. Why are exclusions for children looked after not increasing or not happening? The honest answer is some of our children looked after, particularly at the older end, are at risk of permanent exclusion. But what we are able to do is step in and provide a really personalised approach and a really personalised package, which I'm able to fund through the pupil premium grant funding that is centrally retained, and really support the setting and the child and the carer in some instances as well, to be able to see what isn't working and what can we do to support the needs that are arising or that perhaps leading to an exclusion. Does that answer your question?
Yeah, it's a real problem. It's a real issue, I think. If the argument is that for mainstream children, non-looked after children, if you gave them extra support, you'd have less exclusions. And then you go back to, I can't remember who mentioned it, was it Councillor Holsworth, who said that schools are trying to manipulate, maybe that's a bit harsh, manipulate results. And yeah, it's very interesting, isn't it?
I think the children who are looked after, because we're really, really involved through the personal educational plan, termly review meetings, and also because it's a very much open door to the caseworker that's holding the child or that young person, open, to whichever school that may be. They can approach us and say schools will approach us quite early on and say things are not quite going well, one of your clients at risk of a fixed term exclusion. And we convene meetings very, very regular. I will regularly step in as virtual school head and say, what's not working? What can I do? What can I input? What additional resource can I put in that will address those arising needs to get the young person back on track in terms of their education? And I suppose it's a luxury that is afforded to us through the pupil premium grant that that is made available to us, and that we do centrally retain to allow that personalised approach to happen.
Yeah, I think it's a tremendous success story. You're to be congratulated. Danielle, Councillor Devons.
Sorry, I might be confused here, Parveen. When you said your vulnerable learners and your other role, is that separate from from virtual schools?
Yeah, so yeah, it is. So overall my job title is vulnerable learner service manager, and within that I have a number of other services within the local authority that sit within my portfolio, and the virtual school head is one of my service areas, Councillor Duran, if that
Thank you.
clarifies.
Yeah, can I ask another question then? When you said you will direct some of the pupil premium funding to reduce the risk of exclusion, is that even for children that don't necessarily meet the criteria for pupil premium?
No, the Pupil Premium Plus grant that the virtual school head has responsibility for is purely to be used for children who are looked after, not for the general cohort. If I've understood yourself correctly.
Yeah, you have. Yeah, that's clarified.
Yeah. It's a very dedicated pot of money, ring fenced to children who are looked after.
Thank you. That's clarified it. Thank you.
Again, I go back to the point I made previously. If we had more money, presumably we won't have any exclusions at all. I don't know. I'll leave that one just where it is. Councillor Diana Tremaine. Councillor Tremaine.
Hiya. Yeah, just a question. In terms of the virtual school having a role in terms of supporting previously looked after children as well, I'm just thinking that's not really in here, and because of issues in terms of attainment, exclusions and things affecting, for example, adopted children, I think it's really important that we look at that data and perhaps try and get some information on that, because it is quite a key area. So I'd like to know a bit more about it if possible. If you can't do it today.
No, absolutely. That's a really valid point, and I think I have got quite a quick response to that. The responsibility for previously children looked after and who are either in special guardianship or adopted, the local authority, we do not receive the pupil premium funds for that. The schools receive that. What we do receive for that responsibility area is a grant, and it's the best way to describe it, I suppose, is long arm guidance and support, and that's our role, rather than being involved. So our previously children looked after, we don't have a statutory responsibility for them to have a personal educational plan, to monitor that. That's with the schools, that duty falls for within schools. And also the funding for that element for previously children looked after goes with the school. So we have a very long arm distance role in that. In terms of offering guidance and support, we definitely have a role in providing guidance and support to parents, to carers, to adoptive parents, and also guidance and support to schools. So I hope that answers the question.
Oh yeah, no, I was just thinking about the fact that funding goes to schools, but we've sort of got a gap, haven't we, in terms of not having the data on how those children are doing. So I don't know, is there any way that we can look into that? I don't know if it's possible.
We can certainly, I can certainly explore that, and I can certainly explore, with what because I'm part of a very strong regional virtual school head group, to see what other authorities do. I'm going to be perfectly honest. I've been in the role 10 months, and I want to get my own house in order in terms of what my statutory responsibilities are, and there's a lot of work that I've started that I want to see through in terms of improving, the outcomes for our children looked after. But it's certainly something that I can look after to, I can look into. I'll also add at this point, because I suppose it links in very nicely with it. Very recently, the DfE have extended, have created the pilot extension to virtual school head roles to look at, again, very similar role to what we have to previously children looked after, for those children that are open to a social worker. So that's something that, that's a pilot from September to March that every authority in England is currently working towards. So very similar ethos. So whether anything Councillor Tremaine develops from that pilot that kind of informs the previously looked after approach as well, it will be very interesting going forward, because the DfE have also commissioned a research partner, you know, to look at the impact of this pilot extension duty to our role.
That's great, thank you.
I just have one more thing. 2.5, 0.1, 0.2, 0.3, 0.4, I've heard them a million times, I still can't understand them. But I think they're summarised on the top of page 10 that 62% of Calderdale CLA, or 29 students, achieve 5 GCSE passes at grade 4. Is that right?
Right, that is correct.
And now the next column is national all students, but that's not just looked after students.
No, absolutely. The GCSE data for children looked after nationally is not currently available. So that's why that normally we would put that in, you know, as a comparator.
Yeah.
But
what do you think the 62% represents, given past history?
It's certainly an improvement in compared to where we were last year. The 2019-20 GCSE percentage was, I think, around the 31% mark. Obviously, I wasn't in POSA, but it's still not good enough for me. I'm a bit like yourselves. I'm very outcome driven. And I really want to, the piece of work that I've started with my post-16 coordinators is really not just looking at them as individuals, but equally looking as a cohort, as I would do if I was the head of a mainstream school. Really looking at, you know, we're talking quite small numbers in year 11. You know, last year, you know, we had 29. Is really digging deep, and I've reviewed the personal educational plan from September this year, with progress and attainment being a real focus within that. So when the termly personal educational plan review is taking place, you know, for all our pupils, I can really dig deep on the progress and the data and really challenge where it's why they're not making progress, but equally put the support in if it's identified through, you know, through the gift of the grant that we have.
I think that's, as I say, I didn't understand the previous 4 paragraphs, but that's really good. But this is key, Harvey, to what we should be aiming for, is the educational achievement of looked after children. But until we get that on a parity with the general population, or the non-looked after population, if you like, we're not giving them the best possible chance in life. If 62%, if that carries on to when we're actually taking exams again, I think we should be delighted. But there is obviously things we can do better.
There's lots we can do, and I suppose I'm going to say something slightly off track now, and I'm going to say it because I'm really passionate about this, and I think it's really important that I say this wherever I go. And I know I said this to the charity, that one of the charities that supports us, one of our local charities. When I became the virtual school head in January, I've been in the local authority as a service manager for a good number of years. I'm a teacher by background. When I read the personal educational, when I started to read the individual personal educational plans, and I looked at the journey of the children and the reason they came into care that led them to becoming in care, one of the things that, you know, I made a promise to myself, not only to yourself, but to myself as the lead for these children in terms of their education, is I will do the best that I possibly can to enable them to make the same successes in education as any other child. And I've put my neck in the last 10 months, I've put my neck on the line a few times, you know, by really opening up that challenge. For me, saying, you know, I've heard comments like, well, he or she's on the roll of a school, and I'm talking the top end of my cohort here. They're not attending, they're voting with their feet, and, you know, looking at the adverse experiences some of our young people go through, they do vote with their feet. I'm not going to deny that. But then saying to me, well, we'll put tuition in, or we've put tuition in, and that's acceptable. I've actually said openly more than one occasion, no, that's not acceptable, that's not good enough. I really want to find out what is it. CK careers have been involved in those conversations where I've said, what you've got links with these people, the home that they are placed in, you've got links with it, you talk to them. What is it that is going to inspire, engage this young person? I'll accept that they may not receive their GCSE levels because they're not engaged and they don't want to attend school. But saying to me that they've got 3 hours of tuition is not acceptable. It's not good enough. It wouldn't be good enough for my child. Therefore, it's not enough. It's not good enough for my children, you know, that I'm responsible. And I've really introduced this personalized approach, not only within my virtual school, and you know, it's turning you know, an oil tanker. It's not going to happen overnight, but it's really putting that conversation out there with our schools, with our other partners, and saying, would that be good enough? Would you accept that for your child? No. What can we do differently? And I've put my, you know, put my money where my mouth is really, and said, I'll pay for it. What will it take? I'll pay for transport if it doesn't meet the transport policy criteria. I will do whatever it takes within my gift to give my children the best possible chance that I can. And that's my ethos, and that's my driving force, I suppose, in my role.
And you'll feel all our support in that, Parveen. I think I've known you quite a long time, actually. I think you were something to do with early intervention many years ago.
I've been around a while.
Yeah, well, maybe even as long as me. Again, I'd like to thank you for the report, Fabian. I'm waiting for all this time. Although I hope you enjoyed some of the earlier meetings. The virtual head role, we like a passionate person in there. And I think that's what we've got.
Good, you've definitely got passion from me, and a commitment. I think that Julie, the director, used to line manage me for I think 3.5 years when Julie was assistant director. So Julie knows what drives me, and what drives me is I want the best for our children in Calderdale.
We absolutely echo those feelings. We all should have ambition for our people.
Thank you.
I don't know what Danielle's up to. Julie. Oh no, that was your thumb. Sorry. Okay.
Yeah, it was just a thumbs up, but now you
Put me in Councillor Rostrick. It's a good time to say, you know, tonight, because Leslie and Rob are not here, you've seen a lot from the service managers, and I think it's been really valuable to hear directly from Parveen and Ben tonight, who are Parveen's not a new service manager. Ben's relatively new into a service manager role, but that bringing the inclusion and the education part together with that unique role for Parveen and for Ben on send, I think you're really seeing the strength of that coming through. And although Parveen's relatively new to the virtual head role, she's making absolutely great strides. And is, you know, the passion shines through, but that individualized approach, and you know what we always say to ourselves, would this be good enough for my child? No, you wouldn't have your child on roll and putting a few hours of tuition and sending them off. You want them having a decent education, and that's what Parveen's doing. So, you know, yeah, I think you've seen, you know, some really good reports tonight, both from Leslie's team. So, you know, well done, Parveen. You've done really well. Thank you.
Thank you. We've got a lot of work to do, but I'm not frightened of rolling my sleeves up and getting on with it, because that's what we're here to do. So thank you.
That's right. I've got a bit of decorating he's doing over here.
I'm not very tall, so I probably wouldn't reach the top of your walls.
I'll get some ladders.
Thank you.
Thanks, Mary.
Thank you. Bye-bye.
Bye-bye. Very impressive. I think, no, she's got it. I think I've heard, but she brought in the early intervention help some teams. Is that 10, 15 years ago? I can't remember how long, I've forgotten.
Yeah,
Parveen's got a background in education. As she said, she's a qualified teacher. And she came into children's services from like a kind of deputy headship role to lead up the education side of early intervention. So she's always had education, welfare and a number of those services, even when she was leading early intervention. You remember Councillor Raystrick going way back when Carol Stone was here for the youth service, Jeff with youth justice service, Parveen had education, and Steve Woodhead had the family intervention team, and the four of them were an amazingly strong team with all the different aspects covered. So yeah, Parveen's been with us a long time with an education background, which is good for us.
That's really good. Anyway. Item 9, members. It says it's for information only on the work programme, I think, and I just have one comment, Julie. I like the agency workers and the numbers of that all seems to be under control. But if you look at page 5, it's the point I made before, and the point you always explain away by early intervention and early help. Children in need down 15%. Child protection plans down 33%. Yeah. Looked after children up a little bit. Yeah. Compared to the comparative, those figures, they look amazing.
Yes.
Why isn't anybody else doing it? Why aren't anybody else's figures getting as good as ours?
I think it's a good time
And I know you've had an email from Councillor Wilkinson about this earlier in the week, just to mention the front door health check that we had done last Thursday. We had the initial one done. This is something we've developed in the region, where we get experts who run their own front door services, the front end of taking the child protection referrals in their own councils, who will come in and have an external look at what we're doing. And we had one done in January 2020. It was led by Mel John Ross, who's the director in Barnsley, and she came back to do the follow-up with Rob Mail, who's our regional improvement person. So there's a lot of preparation work done by Zell and his team managers and Rob. A lot of data is obviously shared, because when you look at the data of how quickly and efficiently we're dealing with the child protection work that comes in, that we do our assessments on time, our case conferences are held within 15 days, our performance is incredibly strong. And they were looking at what had we done with the learning that they found. And what they said is we only had one door in, which was the front door, mask door. And we needed an alternative for those families that needed some help but weren't going to meet the child protection threshold. That's what they said in January 2020. And they said the creation of the early help hub that is really taking families immediately, away from MAST, particularly young people with antisocial behaviour, maybe at the low level, kind of started to offend, may have gone into the youth justice system, but making sure families can get that support earlier. And what we're doing is tracking those families that come into the early help hub at 6 months and 12 months, and the majority of them are not coming back for a child protection service, which is really good news. So what we're doing is bucking the national trend. What they wanted to do when they did the front door health check last week is to say, because it can be a pendulum, you'll know this, that you can swing from over intervention into under intervention. They wanted to make sure that we were not under intervening, with the right families. And I'll just tell you what some of the verbal feedback was. They said the breadth of the work that's done by the Early Help Hub and MAST and CAT is there. We haven't stood still. Said we're in a really good place. They could see that we had the eyes on the children, and that reduction they saw in the children in need and child protection was positive, because what they could see is the work that actually is being dealt with by MAST and CAT is complex. There's a lot of domestic violence in there. There's a lot of big families. There's a lots of what we call the toxic trio, the drugs and the alcohol and the domestic violence. We do have those conversations, that constant learning. They said you could see it was a learning organisation, but they thought the early help data, the data from the hub was really, really promising. And they just use those words, which I sent you in the email, which you'll have seen, to describe the service, which I've got to say, I was on cloud 9 by the time they finished. It was like for me having an Ofsted inspection, because it's, you know, you don't know, you think you know what your service is like, but to have somebody to come in from outside. So they said it was thoughtful, constantly curious, ambitious, passionate, aspirational, you know, inclusive. The development areas were there. But what they said, and I think this is what you need to know, is that tight grip. They said is palpable. You can feel the way Zell and those team managers are managing the front end. They said it is tightly managed. The grip is there. It's integrated, the integration with the police and other parts of children's services, and it's innovative. And Mel John Ross said it was a joy, an absolute joy to come in and hear what we're doing and how we're just taking it further and further. And they described this humble leadership that, we're not sitting back saying, oh, we've done it, we're great. We're always looking at ways to improve. So Rachel Brady, one of the team managers, was just saying, her ambition is to get out there more, doing joint visits with the Women's Centre, getting out there more with women who may decide to retract their statements with the police, doing a lot of that, getting out there, having those conversations, doing a lot of the hand holding and trying to keep women and children particularly at the centre of what's going on and keeping them safe as well. So, it was, I think it's good validation for you to know that we've had that external line. It looked at the whole system, and what they're saying is there is a whole system. And I wondered, looking at this report, do we draw the early help figures in for you so you can see what's coming into the early help hub as well as the front door, how many referrals are being picked up and children dealt with, how many are coming back after 6 months, how many coming back after 12 months. It would give you the rounded picture if you would like, if you'd like me to include it.
I think we'd like to see that on its own, really.
Okay.
Perhaps at some stage.
Yeah.
We as you already mentioned, we had Master here in the front door. I think we were quite impressed with it. I think we'd like to see that as a sort of. It's obviously going to be a good news story. Why shouldn't we have one every now and then?
Yeah, that'd be good, and it would give chance for you to see people. You remember Brandon, who actually came to the town hall and he saw you. Brandon is still there, managing the hub from the police side. He's another one. He's Guy Greenwood's brother, who manages the residential. They're very passionate, very committed. We have got some really,
Is that right? I'm very impressed with that.
Very committed. Yeah, very committed, very passionate about young people doing the right thing.
Maybe if you've got enough data to December, we can do that in December. If not,
okay.
All right, then there's nothing further. The work plan, I'll just make one. We're going to have public health in January, and that's about all I'm going to talk about, really. Sarah, Lauren, and I'll sort out the rest. One other thing, members, there's some members training next Tuesday, early help hub and systemic practice, very relevant to what we've just been talking about. In I guess it's going to be Zoom, Tuesday night, 17:45. That's my little advert for Amanda's enterprise. That's it, members. Quite an early finish tonight by our standards. I'm not going to get you waiting too long. Again, I thought we send a really good run. It's not as simple as saying that's a really good thing. I think there's obviously a lot of work to do in that send. It's a huge topic, and I think we are getting there, but I think there's still some way to go. Sarah.
Yeah, I just want to say how what a great. It's just been really, it's been really interesting this evening, but also the commitment and passion that the officers have shown tonight has been very heartening, and it's just such a glowing endorsement of this department, and it makes me feel really proud to be a small part of what's going on, children and young people. I think overall, I feel really proud and hopeful. We're in difficult times, difficult circumstances, being battered from all directions in lots of different ways. And I just feel like there's been a bit of a beacon of hope in seeing the passion and commitment here this evening. So thank you, Julie, and Adam, really, for running you know, a brilliant ship.
Sorry, did you call me there, Chair?
Yes, sorry, Adam. Yes.
Sorry. Yeah, thanks, Sarah. Completely agree. I've actually just emailed some of our officers just to sort of thank them actually for presenting tonight. I think the passion's really shone through. What I was just, the reason I put my hand up though was just to agree with you, Colin, about the SEND review, and I think it's worth bearing in mind that it's not due to complete till September next year. So it's probably worth having it back at some point. And also, obviously, the national review is yet to complete as well. So it's still ongoing. We know we've still got work to do on it. Thank you.
I'd just like to echo Sarah's comments. I think the last 3 or 4 meetings, the summing up has been really similar. It's been, I think, as Julie said at the last minute, a pleasure to sit here and listen to some of the reports that were coming. Even if they didn't all have good news like the SEND news tonight, they did show that we are a really hard-working organisation with a bit of ambition for what we're trying to do. And that's to all our credits. We're only a small part of it, but we are some part, and it takes all the cogs to make a wheel. All right, members, go and get your dinner. Oh, thank you, Julie. Oh, I don't really speak, so go and get your dinner.